Hi, I'm Dr. Dave. The spinocerebellar tract is a set of axonal fibers originating in the spinal cord and terminating in the ipsilateral cerebellum. This tract conveys information to the cerebellum about limb and joint position. Proprioception. Proprioceptive information is obtained by Golgi tendon organs and muscle spindles. Golgi tendon organs consist of a fibrous capsule enclosing tendon fasciculi and their nerve endings that respond to tension in the tendon by causing action potentials in 1 billion different neurons. Relatively large, myelinated, quickly conducting. Muscle spindles fibers are complicated systems of tension monitoring within muscles which result in information being carried via 1 and number 945. Neurons. Larger and faster than 1 billion. From both nuclear bag fibers and nuclear chain fibers. NII neurons. Solely from nuclear chain fibers. All of these neurons are first order, or primary, are sensory, and thus have their cell bodies in the dorsal root ganglion, and pass through Reeks laminae layers I, VI of the dorsal horn, to form synapses with second order, or secondary, neurons in the layer just beneath the dorsal horn layer VII. In the dorsal tract, the sensory neurons synapse in an area known as Clark's nucleus or Clark's column. This is a column of relay neuron cell bodies within the medial gray matter within the spinal cord and layered VII. Just beneath the dorsal horn, specifically between T1L1, these neurons then send axons up the spinal cord and form synapses in the accessory, lateral, cunate nucleus, lateral to the cunate nucleus in the medulla. Below L1. Relevant neurons pass into the fasciculus gracilis, usually associated with the dorsal column medial lemniscal system, until L1 where they synapse with Clark's nucleus, leading to considerable caudal enlargement. From above T1, neurons enter the fasciculus cunatus directly and again synapse with neurons in the accessory cunate nucleus. This pathway is known as the spinocerebellar tract. The neurons in the accessory cunate nucleus have axons leading to the ipsilateral cerebellum via the superior cerebellar peduncle. Some neurons of the ventral spinocerebellar tract instead form synapses with neurons in layer VII of L4S3. Most of these fibers cross over to the contralateral lateral funiculus via the anterior wide commissure and proceed up the spinal cord to synapse with neurons in the superior cerebellar peduncle. The fibers then often cross over again within the cerebellum to end on the ipsilateral side. For this reason the tract is sometimes termed a double crosser. The rostral tract is similar but is uncrossed and enters the cerebellum through the inferior cerebellar peduncle. Thanks for listening. Goodbye.